Now for another cardiac procedure which we'll get to discuss this afternoon, this is what is known as heart catheterization. Heart catheterization. Okay. So for the heart catheterization, it's just simple. You are trying to put a catheter to the heart. So you usually would approach it using the femoral, okay, vein side. So you put it from down up. Okay. So let's talk about it. So it's also known as cardiac catheterization or cardiac cath. It's a minimally invasive procedure. Now you can use it to diagnose a disease. You can also use it to treat. So it has two roles: diagnosis and treatment. Okay. So you insert a thin tube into a blood vessel, and all along you guide it up to the level of the heart. Okay. So it's a diagnostic and therapeutic procedure. That means you can use it to confirm disease. You can also use it to treat disease. So a catheter is inserted into a blood vessel in the arm. It could be groin or neck. The groin one is the one that they always use. That's why you always see them, the pictures having the groin insertion. So once combined with angiography, often combined with angiography, where contrast dye is now injected. So after you do it, you can now inject the dye, then do imaging later, just to see more clearer pictures. So why is it done? Why will I actually have to do this cardiac catheterization? Okay, to diagnose coronary artery disease, to evaluate heart valve function, to measure pressures inside heart chambers and vessels, to assess if the person has all those congenital heart diseases. Then what next? You can also, that's to diagnose, but we're saying you can also use it in treating disease. So you can use it in treating treatments like angioplasty, where you're trying to now place balloon between arteries that are kind of like getting blocked. So the balloon will help to keep them widely open. You understand? Stent placement, valve repair or replacement, ablation for what? Heartbeats that are abnormal. So what to expect during the procedure is the heart, so they have to be careful. So it takes several hours. Okay, they can do blood tests, they can do imaging and all of that. So they can give you anesthesia during the procedure. Alright. Contrast dye can be given to you, and later on they do imaging. Okay, so after the procedure there could be bleedings, okay, or pain. So if such a patient to rest, and of course you limit movement for some few days. Okay.